Deep hypothermia is one of the most innovative and exciting areas of modern medicine. This treatment aims to prolong life and increase the chances of survival in critical medical situations. By deliberately lowering the body's temperature, what was once considered science fiction or a futuristic medical technology is now being used in clinical practice. And its potential is causing a stir in the medical community. The basic principle of deep hypothermia is to reduce the body's need for oxygen and nutrients by drastically reducing its metabolic activity. When the body temperature is lowered from normal body temperature of 36.5 degrees to below 28 degrees, which is considered severe hypothermia, the metabolic activity of cells is significantly reduced. This helps to minimize damage caused by lack of oxygen, especially in vital organs such as the brain. The most notable application of this treatment is in post-cardiac arrest treatment. When blood flow to the brain is cut off due to cardiac arrest, brain cells begin to rapidly deteriorate. However, in deep hypothermia, this rate of damage is significantly slowed. Lowering the patient's body temperature to 32 to 34 degrees Celsius after CPR has become the standard treatment protocol, significantly improving survival rates and neurological outcomes. Deep hypothermia also shows great potential in treating brain injury. It can be effective in reducing secondary brain damage following traumatic brain injury or stroke. It can improve the chances of recovery by reducing brain swelling and suppressing inflammatory responses. Some studies have reported improved survival and functional recovery in patients with severe brain injury with deep hypothermia. Deep hypothermia induction during surgery is another important application. This technique is particularly useful in complex surgeries such as cardiac or aortic surgeries that require temporary cessation of blood flow. By lowering body temperature, the surgical team can work safely for longer periods of time, which contributes to increased surgical success and reduced risk of complications. Another potential application of deep hypothermia is in the treatment of severe sepsis. Sepsis is a systemic inflammatory response that can lead to dysfunction of multiple organs. Deep hypothermia can help suppress inflammatory responses and preserve organ function. Research is currently underway, and early results show promising results. However, deep hypothermia treatment still presents many challenges. One of the biggest concerns is the potential complications that can arise during the process of lowering body temperature and returning it to normal body temperature. Serious arrhythmias, blood clotting disorders, immunosuppression, and electrolyte imbalances can occur. Therefore, very careful monitoring and management are required when implementing this treatment. There is also no clear consensus on how much body temperature is most effective and how long hypothermia should be maintained. This can vary depending on several factors, such as the patient's condition, underlying disease, and when deep hypothermia treatment is initiated. Therefore, research is ongoing to develop the optimal protocol for each situation. Another important aspect of deep hypothermia treatment is ethical considerations. In particular, in patients with brain damage, deep hypothermia can prolong life, but it can also lead to prolonged unconsciousness. This raises complex ethical issues related to the patient's quality of life, the burden on their family, and the allocation of medical resources. Therefore, when applying this treatment, not only medical judgment, but also ethical considerations must be carefully considered. Advances in cryotherapy technology are opening up new horizons in medicine that save and extend life in extreme situations. This has the potential to go beyond simply increasing survival time and increase the possibility of recovery and provide a better quality of life in serious medical situations. In the future, cryotherapy is expected to become more sophisticated and personalized. For example, technology may be developed to selectively cool only specific organs or body parts. This will allow for focused treatment to the necessary areas, while reducing the side effects of whole-body cryotherapy. Research is also underway to develop cryotherapy protocols, optimized for each patient using artificial intelligence and big data technologies. This is expected to maximize the effectiveness of treatment and minimize side effects. Furthermore, cryotherapy technology can be applied to areas such as space travel and survival in extreme environments. For example, the development of human hibernation technology to keep astronauts in a state of hypothermia during long-term space travel is actively being researched. This may sound like a story of the distant future, but advances in hypothermia treatment technology are making this dream a reality. Hypothermia treatment can also bring about a revolutionary change in the field of organ transplantation. One of the biggest limitations of organ transplantation today is the limited time for which organs can be preserved. Using hyperthermia technology, the metabolic activity of organs can be drastically reduced, greatly increasing the preservation time. This will increase the success rate of organ transplantation and provide more people with the opportunity for transplantation. However, along with these developments, we must also recognize the limitations and risks of hypothermia treatment. This treatment is not a panacea, nor is it applicable to all patients. It can also cause serious side effects if misused. Therefore, careful judgment and strict adherence to protocols are always required when using this technology. Hyperthermia treatment expands the boundaries of medicine, but at the same time raises many ethical and philosophical questions. How far does life-saving end and how far does meaningless life extension begin? What is the meaning of surviving without consciousness? Social consensus and discussion on these questions will be necessary. In conclusion, hypothermia is an innovative technology that is expanding the boundaries of modern medicine. It presents a new way to save and extend life, and at the same time, it makes us reconsider the nature of life and the purpose of medicine. It will be very interesting to see what new possibilities the development of this field will open up in the future, and how our society will accept and utilize it. Hypothermia is a window into the future of medicine. Through it, we are discovering new ways to extend human life and recover from diseases. However, at the same time, it requires us to deeply reflect on the value of life, the limits of medicine, and the ethical use of science and technology. The future that hypothermia will open up will be both hopeful and challenging. We must keep an eye on the development of this technology and continuously discuss and prepare for the changes it will bring.